If you enjoy local content like this, please like, comment, and share. It will help us out a lot. So please like, comment, and share.
I'm again using Katie, a local model who has volunteered to act as a patient for us so that I can show what a total hip replacement is like. Many people think of their hip as being in the ass end, really, the posterior or buttock area, but in fact the hip joint is located anteriorly in the groin. This cup is where the acetabulum or portion of the hip is. This represents the femur. The head of the femur articulates with the cup, so it sits about right there. Katie, will you move your leg straight up in the air? And you can see how that moves the hip back and forth. Now in a hip replacement, what we do is cut this area off, and that's replaced with a metal stem and a metal cup, a metal head that goes inside a plastic cup that is cemented inside of the pelvis. There are 3 surgical approaches to the acetabulum and the femur. One is the anterior approach, which is marketed as a new approach. In fact, it's quite old. We've used it for children for many, many years. It's more recently used for adults. It has some complications in that there are major blood vessels that come through here, and there can be significant blood loss. The surgical timing of the procedure is much longer than the more traditional anterolateral or posterior approaches. Other approaches are an incision on the outside and pulling the muscle off of the bone coming anterior. That's the anterolateral approach, of which I've done probably thousands of. It's a little bit more stable in its approach. There's far less blood loss, and the surgical exposure time is typically only about an hour as opposed to probably 2 hours with the anterior approach. And then another traditional approach is the posterior approach, where you come in from a little bit more behind. There's a slightly higher increased risk of infection and dislocation rate, but the surgical time is even less, approaching 30 to 40 minutes. Like a mechanic, if I take my car to the garage, I don't tell my mechanic how to fix the car. So when you're getting your hip replaced, you don't tell your surgeon how to fix your hip. You go with your trusted surgeon and his or her approach to the hip. If you were to tell me I want my hip replaced through an anterior approach, well, first of all, I'm not going to do it that way. And second of all, you wouldn't want me to do it that way because I'm not as comfortable doing it that way, and I don't like the complication rate. But again, you have to feel comfortable with your surgeon. There are at least 3 different approaches, and that's what a hip replacement is. So it's replacing a portion of the stem of the femur with a metal head. Sometimes the metal head is made of ceramic rather than metal, and it fits inside of a new cup that fits inside of the pelvis. That's a total hip replacement. Hi, I'm Dr. Mark Chilton. I'm a board-certified orthopedic surgeon here at MMI, or the Mid-Maryland Musculoskeletal Institute. We're a division of CAO, or the Centers for Advanced Orthopedics. We started out as a 2-person orthopedic group more than 30 years ago and have morphed into about a 175-person group, all devoted to musculoskeletal care that stretches over about 40 offices from southern Pennsylvania to northern Virginia and DC, including most of Maryland and a little bit into West Virginia. Again, we cover all the musculoskeletal ailments, not only including surgery, but also non-surgical specialists, including rheumatologists, physiatrists. We take care of pain management. We handle durable medical equipment, physical therapy, the full musculoskeletal works.
If you enjoy local content like this, please like, comment, and share this video. If you own a local business, please join us.